Are you good? Okay, hey, so I wanted to just kind of go through some health changes, some things that are upcoming. This is distracting me, sorry. Okay, there, I think we're still good. Some things that have maybe recently changed with my health management system and things that I'm planning on changing or looking into, whatever. It'll make sense as we go through it, okay? So the first thing that kind of prompted this is that I got a new prescription in the last week and I just went to get lab work done today. So I thought that it was a good time, like things have kind of made a change. We've kind of seen a shift in things. So quickly, my main diagnoses are migraine. I've had migraine for forever. Usually I've been in a chronic migraine state. Right now I'm more like frequent episodic where I'm having 2-ish attacks a week, give or take. I don't know. I really haven't been tracking, so that's kind of my bad. I don't know. But yeah, migraine and migraine with aura and menstrually related migraine are kind of those like sub classes of my migraine type. And then I've always had anxiety. I don't know when it was officially diagnosed, but I've always had anxiety as well, which I've always felt like my mental health has gone hand in hand with my migraine severity. Like whenever I'm doing worse migraine wise, my mental health gets a lot worse too. And then my third primary health diagnosis that we're kind of keeping tabs on right now is ADHD. I was actually diagnosed with this in the last 1.5-ish time frame. So that has been a big change in the last couple of years. So anyway, that all being said, let's see. Oh God, I don't know where to start, dude. So there's actually not really any major changes right now with my migraine situation. I'm on a stable management plan where I take a once a month injectable for migraine prevention called Emgality, and then I take as needed whenever I get migraine symptoms. I either take my Nurtec, which is prescribed, or I also tend to take Aleve as my go-to over-the-counter medication. I don't know why that's the one I latched onto. Whatever, it is what it is. So that is relatively stable. I do suspect that story could potentially I think those medications are going to stay the same, but I do think we'll see a change in my migraine situation as well here soon. ADHD, I have sorry, I'm hearing a dog bark, which I'm in front of my house and my dog is in there, but she doesn't bark, so I think it was a different house. Anyway, oh my God, lost the plot. I don't know what the generic of this is, but I take methylphenidate for my ADHD management. So I take that twice a day with breakfast and with lunch, and that works really well for me personally. It is fabulous. But at my most recent psychiatrist appointment, I brought up to her that I brought this up the last 2 appointments, but I don't know. The first appointment when I brought it up, I just noticed not only am I seeing that my migraine is so tied to my menstrual cycle, where I get menstrually related attacks, so much more clustered attacks around my PMS stage and the actual menstrual part of the cycle, the actual period part of the period week. I don't know what I'm even trying to say. I get such significant clustered symptoms for migraine at that time, but I'm also really, really noticing that it is so much more than just migraine. I'm dealing with a lot of symptoms to the point it's debilitating. It's so much anxiety. My ADHD meds stop working effectively. I'm so fatigued. My anxiety spikes, and it's not even just for a short period of time. It's literally half of the month every month. It's gotten unhinged where it's right after ovulation ends and the luteal phase begins, everything goes downhill. It's miserable. And I brought that up to her 2 appointments now, and I see her pretty regularly, so it's not like she's not doing anything. The first time I just brought it up and she gave me some suggestions for more holistic measures, which prompted me to remember to start taking my supplements that I've now again stopped taking now that I'm thinking about it. Oopsie doopsie. I guess we'll circle back to that. But I did more holistic stuff and it didn't really do anything significant anyways. So then whenever I saw her in the last week, she's kind of thrown around loosely the diagnosis of PMDD, premenstrual dysphoria disorder. I don't know if that's actually the title, but PMDD, which it kind of reflects what I described, where it's not PMSing. It's the whole luteal phase to menstrual cycle is extreme, we're dealing with extreme situations. So she kind of unofficially, or maybe officially, I haven't seen the clinical note from her end, diagnosed me with PMDD. and has suggested that I start taking, which I literally just started this today, you guys. I just started, it's Prozac essentially. This is a different, it's the generic version, but basically Prozac, which I haven't done really much research, and this wasn't really the answer I was hoping to get. So I don't know how long-term this situation is going to be, but I did just start taking Prozac today. I picked it up at the pharmacy yesterday, and one thing about my psychiatrist, I love her. I really do. I am like 1,000% sure she also has ADHD, because every time she gives me some sort of recommendation of like a treatment plan, I feel like it's so vague, and I'm like, I need you to like narrow in and tell me an instruction, girl. Like it's very confusing. So like even with my ADHD pills, I take 2 different pills like 2 different times a day, but she's told me like, oh, you don't have to take that full amount, like you can cut them in half and like see how you feel. You can take both of the pills at once, you can split them into like 4 different times of day, like you can, I don't know, it's insane. Okay, so whatever. And then when we're talking about, well, whenever she recommended holistic stuff, it was all also vague. Like it was just a list of like types of supplements. It didn't have dosage or instruction or anything, so that was fun. Again, I swear I do love her, and she does help me a lot. But then with this, it sounded initially like I was supposed to time it with that luteal phase and the menstrual cycle, the menstruation phase. Like I was supposed to time it with that, but I do have somewhat irregular periods, like not extreme, but somewhat irregular. So she has basically said like, let's just try it every day until the next time I see her, which is in less than a month now. So we're going to see how I feel in less than a month. We'll see how it goes. So yeah, I did just start a new medication, which I haven't done a ton of research with that. And like I said, it's not really my preferred long-term solution. I'm not anti-meds. Obviously, I've listed like half a dozen medications I'm taking already, but like, it's just not exactly what I envisioned being the solution for what I'm experiencing. But if it helps, that's amazing, because like I said, it's almost debilitating. It's excruciating to exist half of the month, and it's crazy because I've been dealing with this for a really long time, obviously, and it's like I become delusional. Like as soon as that phase ends and I enter the other half of like my cycle and everything, I'm blissfully ignorant of the fact that like things were debilitating a couple of days ago. Like it's insane how I just like push it out of my mind. I just realized I'm still wearing my glasses. I can take these off. Can you see that they're like smudged? I'm making a little list. I am a chaotic person related to my ADHD, and there are so many things that I don't have time for and like cannot be bothered to pay attention to, and one of them is cleaning my glasses. I'm starting a list. It's really fun. Oh gosh, why are my eyelashes sticking together? Okay, so what have we chatted about? I've kind of just info dumped. I feel like my brain is a little bit unorganized right now. I probably need a snack. I think I need a snack. Okay, carry on, Casey. I hinted at my dissatisfaction. I did a little bit of research into this, and I just am envisioning some sort of hormonal treatment, essentially, like with birth control hormonal treatment. I'm giving you all of the details. This is crazy, my dude. I'm so sorry if this is like too much info, but you're here, you're curious. I'm currently on a non-hormonal method of the copper IUD. It was the worst thing in my life to have it inserted. I am terrified of the day that I have to take it out and potentially have a new one inserted. That's going to be a nightmare situation, and it literally gives me anxiety just thinking about, like, I feel myself getting worked up just thinking about this, but we're going to move on. I have my copper IUD, and the reason I opted for that is because I became very scared essentially of hormonal birth control. I used to take just like the regular pill. I don't know which one anymore, but I used to take a birth control pill, and it was a couple of years of taking it where I realized that I'm technically at risk where I'm not supposed to be taking that. So if you have migraine with aura, which is any of those sensory disturbances, whether it's like the visual differences, which is one of the main things that I get, like splotches in your vision, or I often get tingly sensation in my extremities, my fingers and toes, and sometimes parts of my head will get tingly sensation. So that is a type of aura. So since I get that puts you at an increased risk of stroke, and having a birth control pill that combines like both of the hormone types. I forget, I always feel like I'm saying this wrong, but the progestin and then there's estrogen. And I think it's the estrogen that puts you at increased risk of stroke as well. Just baseline puts you at a little bit of an increased risk. So technically, people that have migraine with ARA diagnoses are not supposed to be getting birth control that has estrogen, if I'm understanding it correctly. Please correct me if I'm wrong, but that's my understanding of what I remember. So I was like, hey, we need to do something else. So I did try a couple of other methods, and they went so horribly wrong, you guys. They were devastatingly debilitating migraine wise. So like in the one that was like the final straw, I tried actually to get an IUD, and it was so difficult, that procedure, that we opted out and quit. So it's crazy I went back and got another one. But I did the arm implant, and it was so excruciating the entire time that it was in my body. It was so bad. So I was like, I'm so done with hormones at that point. Then I opted for the copper IUD, but now I'm really like feeling like I don't know. I feel like part of that decision was like this almost anti-medication phase I was in at the time, where I had lost a lot of trust in like the medical system and medications, just because like I'm sure a lot of you have a similar experience, like going through like trial and error over and over and over, trying to find a medication regimen that like works for you. I just like had tried so many things that didn't work for me that I was just like fed up at that time in my life. So I think I kind of entered this like weird anti-medication phase, right? So I think part of the avoidance of a birth control method that included hormones was kind of that wariness about medication. I don't know. I think that played into it. And I'm so far from that phase now. Like I'm all like, if we need medication, let's take the medication, girly. So like I'm all for it now. And I'm just so fed up of like dealing with this every single month, you know? Like it's just like, it feels like it's harder to get through every single time. And I don't know why I keep having to go through it. Like there are solutions here. So I ideally just want to take my menstrual cycle out of the equation. It's like, what's all the fuss about? You know, like I don't need it right now. Like I would just take it all out, like surgically remove the whole thing. But I don't know. It's extreme. It's the right solution for some people. It's not the right solution for me right now. But yeah, I just am really, really, really interested in some sort of I keep saying menstrual. I don't know why I keep saying that. I'm so sorry. So I'm so interested in some sort of hormonal method that is going to keep me stable 30 days a month, right? Like I do not want a menstrual cycle anymore. I'm so sick of it. It's those hormonal fluctuations that really impact my migraine health in a negative way. And it's the same kind of thing where it's the dips in, I think, estrogen that really impact my mental health in a negative way as well. So I'm just like done. I want to get on something else. I would love to change to one of the hormonal IUDs, but like I said, I'm petrified of the day that happens. So I'm interested right now in just like adding, I think they call it the mini pill. That's my interest and that's what I want to do. So anyway, in my most recent appointment with my psychiatrist, we did talk about this option, but she's like, you need to see your primary care doctor. And I'm like, okay, girly. Here's the thing though. So here's the thing. I told you at the beginning of the video, I got labs done today. I still have my little Band-Aid, which I can absolutely take off now. I remember I was dealing with some like dizziness that I was a little bit concerned about. And I asked to see my doctor, and we made an appointment, and she ordered lab work. And then I didn't go and get my labs done. At first it was like kind of a procrastination thing and like an uncertainty. And also I'm just like bad at blood draws. I'm not scared of them. I'm fine with them, but like I tend to have trouble with, not me actually, it's the phlebotomists that usually have the trouble finding my veins. That hasn't been sorry, what the heck is happening? That hasn't been an issue the last like several times I've had any blood work done, strangely. So I don't know what changed. Let's keep it going though. I don't know. But yeah, I think there was a little bit of baseline anxiety just because it's always like, it's fine, but it's always a little bit tedious for them to like stab me over and over. And then like, I wasn't totally sure of like the whereabouts of the place to get the labs done. And also I wasn't given a clear instruction of like, do it this day. It was just like, I'm going to order this for you. Go do it whenever you want. So then it became never, right? Like there was no urgency, because then kind of naturally I stopped dealing with as much of the dizziness. Like I still definitely have that going on, but to the degree that I'm more comfortable with. And I think it's probably, we'll see, because I did get the labs done today. I think it's probably low blood pressure. I do tend to run low. But who knows? Maybe I do have anemia or some sort of deficiency. I don't know. We'll find out. Side note, is it weird to show you all of my labs like in detail? Because I think I'm going to. I think we're going to go through them together. I haven't decided definitively yet, but like I'm an open book. I don't care. You can know what my blood is saying. It's fine. And I'm nosy. I like knowing that. And I'm actually a dietitian and I work in clinical settings and I'm always looking at other people's labs. So I'm just like very excited to see what my lab work is saying. I won't show it to you if I'm ashamed of it and like I have like raging diabetes or something, but I will show it to you if everything is relatively okay, probably. Let's see. I did lose the plot again. Oh, okay. So I've been wanting to call that doctor specifically about this birth control situation for literally months, but I'm so scared to reach out to her because I didn't do the lab work she ordered. So I'm like, I can't call her. And like, I got this whole like RSD, which is a ADHD thing, rejection sensitive dysphoria, where I'm just like, she's gonna hate me and think I'm the worst person in the world because I kind of procrastinated and forgot to do the lab stuff. I was so scared and I'm like, I cannot reach out to her. So I'm like, girl, you have to get the labs done. Just go ahead and do it. And it was uncomfortable today because like they couldn't find the orders right away because it had been so long. And like, I don't know, I had to have the same conversation a couple of times. Like, yeah, I'm an idiot. I procrastinated this and now I'm here. And they're like, oh, but you're here now. So they like handled it well and made me feel better about it. But anyway, I finally got the lab work done. So once it's done, I don't know if they're going to call me or if I'll call, but that's when I'm going to definitely bring it up. That is when I'm going to bring it up because I'm sick of it. I'm sick of it. Also, this is not like the most important thing in the world, but I do have a vacation coming up in February. Right now, as I'm filming, this is January 22nd. So later half of January. I have a vacation in February that I realized is going to be pretty much aligned with my period. And I'm like, dang it. Like, I'm going to have a terrible vacation because I always feel so terrible that time. Which is now unavoidable because I did wait a little bit too long to get the ball rolling on all this other stuff. So like, we're still going to end up having a period at that time. But since I'm irregular, maybe we'll miss it anyway. We don't know. We'll find out, I guess. I don't know. But yeah, that was another little motivating factor, which was good because it gave me a deadline of like, you need to actually start taking care of some of this, Casey. So it got me to actually take care of it. So that's, we're doing it. We're moving the needle a little bit. Yeah, but let's see. What else do I have to tell you right now other than going through lab stuff later? With my migraine stuff, obviously this is tied to my menstrual cycle and my hormones. Like I said, you're going to think you're going to know that I'm a chaotic, unorganized person with this video. I was at my last appointment with my neurologist who manages my migraine medication regimen and everything, which I already had established my whole plan before I started seeing this doctor. So I don't know how, I don't know. Like whenever I've asked him questions, he answers them thoroughly and everything, but like I've been kind of stagnant with getting any like changes. And I've been happy with where my migraine health is baseline for a long time. So it hasn't been in the end of the world, but I have been asking, I think just in the last appointment, really, I asked him about the menstrual situation, and I just was really dissatisfied with his answer because he gave me suggestions for medication things that didn't sound like they would work for me. They would have crazy side effects, and he said that, or like, I'm not going to be able to keep up with it. Like the one that we agreed on, and I didn't realize this was going to be such a problem at the time, was like targeting my Nurtec medications around like the peak of when things are the worst, right? So like right before my period starts and like the day of it starting, which I didn't realize at the time that I'm a little bit irregular, but like it became very obvious by the first period I had after that appointment that I'm like, I actually don't know when to take this because things are not the way that I thought they were going to be. So I was supposed to call him within 3 months of starting that plan, and I absolutely didn't. It was on my calendar, and that day was just like impossible to get to the phone. I was extremely busy. So then I was like, oh, I'll do it later, but I didn't put it in my calendar again. So it's now been a couple months later again, I think. So I don't know, dude. So I just don't know. I just don't know. I think priority is first we're going to wait for the lab work to come in, and we'll chat with my GP about that and maybe ask her first about like the menstrual cycle situation. And if that doesn't bring anything, then I guess I'll go back to the neurologist, because like I said, I don't really have any interest in changing the actual medication stuff going on for my migraine. It's working really well for me. It's just the freaking period and the PMSing and really, I guess, PMDD. So I don't know. Anyway, I think that's it for now. I'm getting cold. We are in the middle of a major like cold wave. I don't know if that's the right word, but it's very, very, very cold where I live in Indiana right now. The last couple of days, it has been like -degrees Fahrenheit. Like I think right now, oh God, that dog scared me. Right now, I think it's finally starting to like warm up. I think it's in the teens, like 19 degrees Fahrenheit, but feels like -1 or something still. So like we're not really like warm yet, but I think we're coming out of that extreme cold. But yeah, no, I haven't been able to walk my dog the last couple mornings because it's felt like -17 or lower the last couple of mornings. So she's been mad at me. My dog's been mad at me. Somebody's walking their wiener dog right now. So I think my husky's probably going to be fine. She would have been fine with the -17 degrees. So like, let's be serious. But I think maybe I'll be fine to walk her. So she'll start getting walks again now. The dog is smelling my car. It's fine. Yeah, but my car is getting cold. That's why I brought up the temperature. My car is starting to like get frigid. So I think I need to get in my actual garage. Yes. And then we'll come and chat later. The only thing I think I have upcoming to chat with you about is the labs, but if I think of more health related stuff, I will let you know. Okay, see ya. Oh my God, hi. Sorry, bad quality here, but they already have my labs up. Dude, they already have my labs up. I don't know. I'm sitting in the dark. I did turn on lights for you. It was like very dark a minute ago. I've changed into my comfy clothes. Although my parents are supposed to be visiting, not necessarily to see me because they don't actually really like me. They're visiting because my dad's work is headquartered here. He works at the same company as my fiance. So they're coming for a work thing, not for me. I'm just kidding, by the way, but they are coming at some point. But I don't know if I'll see them tonight or not, if they're getting here too late. I don't know. Anyway, the labs are up. My finger, the way I'm holding you right now is unhinged. Let me fix this. I plan on saving some like PDFs and screenshots of the results that I can like walk through with you, but this was just very interesting. So I am comfortable sharing these results, but I'm a little bit ashamed. So the one thing that I think is missing is I thought I was supposed to have an A1C lab done, which is like a diabetes screening risk. Like I think that was in my orders, but I didn't see that result. I may have missed it. We'll come back if it is there and I did miss it, or if it comes later or whatever. I'm not super concerned about my risk of diabetes. I just like, that's one of the labs I'm most familiar with as a dietitian. So like that was something I was interested in. But my CBC, which includes like your white blood count, your red blood count, all that stuff. That was all regular, which actually, I don't know that much about all of these labs. Okay, I need to figure out a better system here. Hold on. I don't know much about labs that aren't strictly nutrition related, but I used to have I'm sorry, this angle feels like it's terrible. Oh, that's so much better. I don't know if it looks better, but I'm resting my arm now. I should have gotten out a tripod or something. I don't know many labs that aren't strictly nutrition related. So like red blood count, hemoglobin, like that stuff I vaguely know, and I like know what I'm looking for and everything, and like what to do nutrition related for it, but I'm not like sure about like freaking NCHC. I don't know what that is. So based on these results, I pulled up some of my old medical papers, and I had labs done in 2018. And I think 2021. So that's what I'm kind of looking at. And I used to have abnormal results in this part of the lab exam. And I don't think I was ever given any instruction of what to do for that. But it's normal now, so we love to see it. Then I have two things that I did specifically want to look into: vitamin B12 and vitamin D. I think I have a history of low vitamin B12. Some of my labs were done while I was on a vegan diet, and that was like, we were targeting certain labs based on that. And I think I did have vitamin B12 deficiency at the time. I can't remember. I also have a history of low iron in the past too, but I'm pretty sure that's been resolved for a while. So we did look at vitamin B12, and mine is regular. It's definitely on the lower end of regular, so that's something I'm gonna think about. And then vitamin D, dang it, dude, I am low, and like that's so common for like people in the Midwest in the winter time, it is end of January, like I told you, and I do spend time outside every day. Like I think I joked earlier how I've not been walking my dog in the morning, but I'm usually spending over an hour outside every single day. So it's a little bit of a bummer. I mean, I am bundled up and everything. I was hoping I was able to get away with like natural sunlight, vitamin D, even though we're in the Midwest in winter. Clearly that wasn't gonna work. I am deficient, so I will start a supplement at some point. And I did also just throw away some old vitamin D supplements, but I'm pretty sure they were expired, so maybe I shouldn't like mourn that loss too long. Maybe it's just like, let's move on and buy a new vitamin D supplement. We'll figure it out. The lipid section, this is a bummer, my guy. This is a bummer. Dang it. So my cholesterol is slightly high. I said that word. It's slightly high. And my LDL, which I consider like the lousy lipid thing, L for lousy, and then HDL is for happy in my brain. That's how I explain it to patients when they have abnormal results in this area. So we want this to be a lower number. Mine was a little bit high. So this is not surprising to me per se. The last lab work I had in, I think, 2021 was actually slightly higher than this. Like my results were a little bit worse than this about 4 years ago. So I have improved slightly, but I'm still triggering as high. And this is such a devastation because while I was vegan, I was not high. I was also like young, right? So I was like young and getting away with things probably at that time. But like genetic wise, there is heart health, family medical history stuff and I have always suspected that I'm just like set up for failure in that way, and dang it, I am. And I have like a relatively healthy diet. Like I am not perfect, but I know a lot of Nutrition Foundation stuff, and I don't like eat copious amounts of saturated fat and stuff like that. So like I do think a lot of that is genetic based for me. I am glad to see things didn't get worse because I have not been that much, like I haven't been careful. But yeah, it was actually really funny because it was like right after I stopped being vegan, the labs spiked up. So I'm like, was this my diet or was this just like age coming and catching up with me? I don't know. So those both are a little bit high, but my triglycerides are fine, and my HDL, the happy one, is, I forget how I explained that before, but I'm sorry if I misspoke. But I have dinner coming soon, so I'm like not thinking anymore, and I'm like thinking about dinner. And funny, we're talking about the lipids and like heart healthy stuff. I'm getting a bacon burger, a bacon cheeseburger from Wendy's. We don't eat fast food a lot, but Dan is supposed to usually be out for like a long, up through dinner time on Wednesdays, and today is Wednesday. He's usually gone for dinner, and I was just gonna plan on eating some leftovers. I made some amazing chicken enchiladas last night that I was planning on having like whenever my parents weren't around the next couple days. But he called me, he's like, I don't know what to do. And then he's like, I'm gonna stop and get fast food, what do you want? So then of course I had to ask for something, and I love a bacon cheeseburger. So I actually don't even care about the cheese. I feel like, unpopular opinion, this has nothing to do with this video. Unpopular opinion though, the cheese on a burger, what's the point? I don't taste it most of the time. Like I've always hated American cheese, but I don't understand why cheese has to be on a burger. I don't get it. I don't prefer to have it there. Like if we're trying to cut calories, not in like a restrictive way, but just in a like mindful way where it's like, let me just like not have the things that I don't want to have. Like let's take out the cheese. I'm not gonna miss it. I'm saving a ton of whatever. But yeah, funny, I have high cholesterol, but I'm getting a bacon cheeseburger tonight. So ooh, let's think about my heart health later, I guess. My thyroid labs look normal. I think it's pretty close to what it's been in the past. My general chemistry labs, I was shocked to see my sodium is low. So that's an electrolyte marker, and one of the main reasons is like you're like vomiting, excessively sweating, having diarrhea, like losing hydration, or wait, no, that's the other way around. That's the other way around, Casey. You're losing fluid, so the sodium goes up. So I am apparently probably drinking too much water, which doesn't seem right to me. Doesn't seem right. I don't know. Maybe I also told you earlier that I think I do have lower blood pressure. Maybe I just need to start eating more salt, you know, like ditch half of the heart health nutrition stuff I know. Just start eating salt. Maybe that's what we need to do. I don't know. But that was, I think, the only other abnormal lab results. The iron, I'm scrolling back to the bottom of this. My iron was actually normal, which I am so ecstatic to see, because that's what I really truly thought the issue with my dizziness several months ago now
was. Like, I thought that was what the cause was, and it may have been. Maybe I auto-corrected and resolved it myself, I don't know, but I do have a history of iron deficiency anemia, so that was something I suspected. But the labs look good. So yeah, I don't know if there's anything else I'm going to cover right now. I did think it would just be fun to kind of give you a little, here's what's going on health-wise with me right now, and I will be sure to keep you updated, so subscribe for more in like my health journey story situation and like what we're doing to manage this crazy unwell body and mind. Okay, toodles.
Oh my god, little update that I forgot to make sure I pointed out earlier. In the lab work, I don't have it in front of me anymore, but I did not have the A1C thing. But essentially what A1C measures, this is not actually the diagnosis, like the definition, but this is kind of how I understand it. And sometimes we'll kind of give this as kind of a way to understand it to my diabetic patients, is A1C, hemoglobin A1C, looks back at kind of roughly the average of your blood sugar for the last 3 months. And if it's high, that means your blood sugars have been like high and consistent, that kind of thing. So the reason that, I still don't think I've seen my A1C lab at this point, unless I did miss it, but my glucose, which is blood sugar, was good. It was 83 or something like that. So my blood sugar glucose was good. So I am already like not concerned about diabetes personally. Like there's not a significant family history, and like my diet, just knowing the way that I eat, I'm not thinking that I have diabetes, and my sugar was good. So that kind of reinforces that belief. But I do think that I had an order for it. So I don't know, maybe we'll see it later. I think I just heard the garage open. My dinner is here.